Ladies and gentlemen, good morning.
Address in English, since the conference is a global one, and it deserves the full attention, and it just pleases me so much that this is Prague Castle main conference hall being full with people who care. More than 2 years ago, I visited a rehabilitation center just to be opened, Superhumans, in Lviv, actually close to Lviv, half an hour, in the Vynnyky hospital. And what I saw was a project that was supposed to be open by the First Lady of Ukraine, Olena Zelenská, and leaders of the health sector from all over the world in just a few weeks. And I was walking through mud. It was raining, there were no roads, the building was half standing. And the director, Olga Rudneva, was very calm and self-confident that there is no problem with this happening within the 3 weeks. And she gave me this t-shirt to remember there is nothing impossible for the Ukrainians when it comes to handling their crisis. And she was right. They opened it within 3 weeks. It was beautiful. And this t-shirt stayed with me and is like a symbol that reminds me of all these things. And that's why I brought it today and sort of crossed the dress code of today. To underline it, I even brought a crunch with me, just to show that we are really leading by example. But don't worry about me and my crunch, this is just a prop. We are leading by example in something that worries me very much, in something we should all be worried about. And that is the state of healthcare and state of mental health in Ukraine. Not only because of all the Ukrainians that are affected by it, but also because of our own societies all over Europe. Because as John Donne says, no man is an island. You never know for whom the bell tolls. And this is precisely the bell ringing that we hear from all the speeches, all the beautiful speeches, for which I really can only applaud and thank all my predecessor speakers. Now, the crucial aspect of our efforts when it comes to handling the crisis in Ukraine was that we really wanted to be in the first row of assistance. So we were the first country to send the main battle tanks, howitzers, MLRS, all the heavy military technique that was stopping the Russian aggressors from advancing and taking the whole country. And yes, we come in with our hearts. That's what we do. That's why I have this t-shirt today. That's what you can see with all our delegations coming all over Ukraine, bringing assistance and developing joint projects. And from what I heard, the first time I was visiting this center was, please, let's work out together what we can do in terms of more prosthetics, more doctors being able to perform surgeries and bring back those people to their lives who lost their limbs. And that's what we started to do. We developed projects all over Ukraine in 16 different hospitals, bringing equipment, bringing technologies, bringing even doctors from Czechia. But very soon I started hearing another story. Whatever we do, whatever we were trying to do in Ukraine, when it comes to bringing these people back to life, it wasn't enough. Yes, you cannot find another country where the production of prosthetics would be on a higher level. Luke Skywalker would be jealous if he would see what some Ukrainians are walking with these days. But it's not enough for these Luke Skywalkers to join their previous jobs, to go back to the front line, or just to do something with their family, because they will never be whole without addressing mental health. So with every single project we were doing, there was an underlying emphasis on, please do something that will help our people get back on track with their head and with their heart. And that's precisely something that we haven't done so much. That's what worries me. Mental health, in my experience, is the single most underfinanced topic in the whole story of recovery of Ukraine. Why? Because it's so misunderstood, or maybe not understood. It's not properly understood how much of an underlying aspect this is for the whole of Ukraine, for every single aspect of life. My main responsibility is the recovery of Ukraine, or the coordination of it. And I always start my addresses when it comes to any general topic by also including mental health, because without a mentally healthy society, there will be no recovery of Ukraine. Currently, when I talked with the representatives of the government of Ukraine, they are saying, in order for our economy to function, we need 4 million people to come back from Europe, from those 8 million that have taken refuge. 4 million are missing. Currently, if the war stops right now and doesn't look like it, but there is around 1.5 million Ukrainians with the status of war veterans. And at the same time, you have hundreds of thousands of people who have to deal with severe, acute PTSD syndromes, which is a scale unprecedented and unheard of, and never seen in any of the wars that any of the major Western NATO countries have taken part in. It's uncomparable. It's 2 orders of magnitude above of what the figures were for American troops in Afghanistan or Iraq. Hundreds of thousands of people, and millions who need, say, more balanced medical care. So these are the troubles. And I don't want to preach to the choir here, because I know that this is a hall full of respected professionals who know that this is the case. But I would just like to point to a few possible solutions that we could do. First, what we need to address such a scale of a problem is to create a scale of a solution. We need dozens, if not hundreds of thousands of professionals who can be of assistance. The system needs to be built on a low threshold principle, decentralized, and funded from all kinds of sources. It has to be accessible in every small town in Ukraine. And it has to be affordable. Now, how do we get there? What we see now as reconstruction of Ukraine efforts, and we're going to hear a lot about it next month in Rome, in the July URC conference. So what we hear is we have plenty of instruments already now, and I'm really honored, and it gives me great pleasure that Piers is here today with us from NATO. So that's what we do with it. We look at the sources of the funding. So I guess what we should do, number one, is follow the money, follow the sources of money. NATO, for one, working with the Ministry of War Veteran Affairs. European Commission has several programs, but let me mention Ukraine Facility Pillar number 2 and Ukraine Facility third pillar. You have international organizations such as ICMPD working with migration services, also have resources for this. You have EIB or EBRD with specific programs for mental health. Again, money that is widely unused because of the lack of absorption capacity on behalf of many of the Ukrainian actors. Now, the single most important part of this is the absorption capacity. That's the ability of the partners in Ukraine and of the companies, of all of you who are here on behalf of some companies and solutions, to write properly a project that could be financed. That's the story. Write a project that could be financed, and it's not easy. But the sources are here. And you will have plenty of opportunity to connect the dots today. But still, that's probably not enough. Because this is just the beginning. Still, all the governmental money that will come to Ukraine for the big reconstruction, it's what we call seed funding, seed money. It's the seed you throw into the ground and you nourish it and you hope that one day a flower or a tree will come out of it. So the governmental, the public spending will not save it. What we need is attraction of private investments into it. And how to do that? Practically, just one example, in every single project that will be financed from European money, from EIB, EBRD, from the grant or guarantee scheme from different financial tools, you could have an obligation for the project to involve war veterans, to involve CSR money in a certain percentage for mental health capability, for mental health spending on the employees on the project. Now, should this be a condition, you will immediately come with hundreds of millions of euro with the money that you have now, and with billions of euro for the money that is planned to be spent on the reconstruction of Ukraine in the upcoming years. Now, with this in mind, I wish you to use this day to the full extent. I wish you to enjoy it. And I also wish for this global conference, for this Prague Council conference organized by Viktor Chvátil and his crew, to be just a trigger, a beginning of a series of events in which we will be following, in which we will be continuing to deliver a whole-scale change. We all know that needs to happen. But finding the particular details, the practicalities, is our job here. That's our responsibility. I would like to thank you for your attention. Carpe diem and Slava Ukraini.
Tomáš Kopečný, my moc děkujeme a dnes se na toto téma podíváme ze všech úhlů pohledu. Ten další přidá Klára, Šimáčková a Laurenčíková, vládní zmocněnkyně pro lidská práva. Prosím, dobrý den.
Vážené dámy,
Ladies and gentlemen, it is an honor for me to be here and speak at this major conference. Thank you to Tomáš Kopečný, thank you to Tomáš Petříček and other members of the organizing team for focusing on such an important topic, because it really deserves it. We need to focus on mental health and on the people who suffer from PTSD in the context of war, and they need a system which is ready to help and to provide expert assistance. Thank you to everyone from the Czech Republic. Thank you to those who came to hear about how we can help to people with war experience and to their loved ones. Thank you to our guests from abroad who are ready to support us and together look for possibilities of cooperation. I agree with all that has been said. Thank you to Tomáš for concrete measures and possibilities. And now, during my address, I would like to name a couple of possibilities how to be better prepared to provide expert assistance in the field of mental health, addictions and other topics. We will speak about young people suffering from mental health disorders, about people who faced unprecedented trauma and they cannot be helped without specific, new and innovative treatments. Thank you to those who are part of the decision-making processes, who can actively contribute to that. We invest in this field more and more. We will be very grateful for this. War experience is never individual. Violence and trauma experienced by people do not stop at our borders, and they do not end when the war ends. They impact whole societies, and even in the Czech Republic we have had an experience of this transgenerational trauma. For example, after the Second World War, we have also witnessed the trauma that impacted Balkan countries and so on. Now we host people from Ukraine. They live among us and we need to respond to the situation in a comprehensive way. We cannot just have separate measures, but we need to link them together. We need to bring together different stakeholders. We need to understand the experience of people who suffered from war. And we need to bring together stakeholders from education, from healthcare and other domains. We need to have a deep understanding of these challenges, and we need to be ready to respond. Without a certain security and stability, without providing housing, medical care and other assistance, we cannot help these people live decent lives. And we cannot say that they are psychologically stable. This is why it is important to have a multidisciplinary approach to support a collaboration between all stakeholders and focus on mental health. It is important to focus on crucial aspects of life that I have just mentioned. Right now, the Czech Republic hosts more than 370,000 Ukrainians, including women and children and seniors, people with disabilities and people suffering from serious mental health disorders. This is why it is crucial to bear it in mind and not to forget about these people, but rather focus on them and provide them with special help. We in the government are responsible for the collaboration of stakeholders while helping these people. We have held a number of online meetings with experts from Ukraine, with people providing direct assistance to war veterans in Ukraine, and with people helping their loved ones. We have tried to promote providing psychological assistance and to link with actors from abroad. We have an interdisciplinary team which will be joined by experts from the Ministry of Interior, the Ministry of Social Affairs, but also medical experts and other partners who will have to help us deliver on our mission to help people from Ukraine. We also want to include our partners from the NGO sector, and we need to look for examples of good practice at the regional and local levels so that people who are hosted in the Czech Republic can have better lives. We hope for a reunification of families after the end of the war, and all of these people will need to be supported. They will need support in terms of housing, economic needs, but also in terms of mental health. We need to offer innovative mental health treatment. We need to offer peer support and other novel approaches in the field of health. And such programs can play a major role in that we will be able to face problems such as the escalation of violence within families or partnerships, domestic violence, and so on. If assistance is provided in time, it can prevent an escalation in this violence. And we need to focus on mental health also by raising awareness. We need to offer instruments of help, and we need to increase the capacities of our mental health centers. Another important role can be played by churches, and we also have a close collaboration with representatives of Ukrainian churches. We know that many people will not just look for help on their own, so sometimes it is useful to also target their loved ones, their relatives, and that is why we have programs targeting these people, targeting the children of Ukrainians who will come to the Czech Republic and who will have had an experience with war. We also are preparing other innovative schemes. We try to offer accessible services which are anonymized and which are accessible to whole communities. The key elements we need to focus on are building trust through communication, through raising awareness, through peer support. We also need to build a comprehensive system supporting people with war experiences, and we need to recognize their suffering and their value so that when they come to the Czech Republic, they feel recognized and appreciated. We realize that for them, in order to be able to have decent lives, we need to provide rehabilitation, and we also want to cooperate with labor offices in order to provide jobs for these Ukrainians. Finally, we want to offer a good institutional framework so that we can meet their basic needs. Specifically, for 3 years now, we have been focusing on helping the youth and helping children, and we know that their mental health is very important, which is why we collaborate with schools and we try to offer methodological and educational help to different actors in the field of education so that they are open and sensitive toward these children who should never feel alone, but rather they should be given the right support and be included in the public life in the Czech Republic. We also need to help directly in Ukraine. We need to strengthen our capacities there, which is an important aspect of international solidarity. And I'm really grateful for the partnership that we have with the governmental envoy, Mr. Kopečný. Thank you very much for the opportunity to speak here. Thank you for your inspirational speeches, and thank you for collaborating with us. Have a lovely conference.
Klára Šimáčková.
Klára Šimáčková, Laurenčíková, thank you very much. And this block will be concluded by Tomáš Kašpárek, head of the Psychiatric Clinic of the Faculty of Medicine of Masaryk University and the University Hospital Brno, and also the Executive Vice Chairman of the National Council for Mental Health. The floor is yours.
Dear ladies and gentlemen, thank you for inviting me. I'm really glad that I'm here. I'm here to express and convey many greetings from the Czech Psychiatric Associations and Association. And I'm grateful to be here because this is a great event, and this event has a big potential to bring about significant change. First of all, I would like to thank the organizers that they didn't give up, that they pushed forward, and they really delivered significant change and hope to us, not only to us, but to the brave people of Ukraine. I would like to add 4 simple notions, and I will be very short because I would reiterate what was already said here. And more importantly, the scientific program is so well prepared that I'm really looking forward to it, and there's a lot to learn. I think that there's no big news that we live in times of mental health crisis, that we have to live with significant challenges and risks, and we need to take advantage of the crisis to refocus and to grow. And to do that, we should embrace the opportunity that bring about the innovations and new technologies. What do I mean by that? We should rethink the goal of our psychiatric or mental health treatment. Nowadays, we speak about well-being and quality of life, while people fight for survival, they seek shelter, they fight poverty, they live in loneliness and seclusion because of migration or loss of close ones. We are not able to prevent the development of mental disorders in the presence of these substantial risk factors. This is fact, and we have to deal with that. We have to change focus. Instead of impossible elimination of stress and risk factors from our lives as a preventive measure, we need to deliver the ability to live with stress, to adapt, to increase resilience. At the same time, we need to provide sense of safety, belonging, someone who cares. To do it, we need to embrace what we have, even though we don't know enough about what the innovation brings, or we consider the solution suboptimal. But including the innovations into the medical model enables quality control, enables asking questions about performance, about safety. It enables evaluation and adaptation, be it psychedelics, telemedicine, be it e-health or AI. We can learn from a historical model case, the development of group psychotherapy after the Second World War. These times there was obviously a huge demand on the one hand, and on the other hand, scarcity of resources. Only individual one-to-one setting was available these days, and it wasn't able to cover all the demands. So development of group therapy was something that should deliver treatment for more people at the same time. And there were a lot of critical and skeptical notions from psychotherapists and colleagues who said, this is too impersonal, this is too superficial, it wouldn't be able to deliver significant change, and therefore the group therapy is meaningless. However, during the implementation of group therapy, a new phenomenon emerged that we now consider key curative aspects of therapy, like group support, group dynamic, etc., etc. So let's learn from our experience. We need to implement the innovations as soon as possible and explore their role, be it the support of clinical care, first-line interventions, complementary approach to clinical care in specific situations. I would now like to link my speech to Tomáš Kopečný, because the hardest problem is find a solution that is able to scale up. We might know what to do, but to meet the need that's there, this is the hardest problem, and we need to be really innovative. While dealing with the mental health crisis, we shouldn't forget people who already suffer from mental disorders. So therefore, the before-mentioned measures should go together with capacity building of specialized mental health and psychiatric services for long-term follow-up. Moreover, we need to invest in the research of precision medicine approaches in psychiatry to find a more direct and efficient treatment. Finally, I would like to thank once again the organizers for this great example of good practice, how to think out of the box and deliver hope and for us and for people in Ukraine. Thank you for your attention.
Tomáš?